if you accidentally click the wrong button on your home computer, you just close a browser tab and move on.
Right. No harm done.
Exactly.
Yeah.
But if a nurse clicks the wrong button on a clinical monitor,
Yeah.
I mean, the consequences could be catastrophic. So today we are welcoming you to a custom-tailored deep dive into a spec sheet from HDTVSupply, which is a massive AV retailer with over 10,000 positive reviews. Our mission today is to decode the Hall Technologies 27-inch Medical Touch 2K monitor.
Yeah. Also known as the HT-HVMT27-2K, if you prefer the actual model number.
Okay, let's unpack this, because the very first thing jumping off this page is the $1,601 price tag.
Yeah.
I mean, why does a standard nurse's workstation need a screen that costs that much when you can grab a consumer monitor for, like, a fraction of that?
Well, to really understand that cost, we have to start with the baseline hardware. So it has a 2560 by 1440 resolution, which is 2K, with a 16 by 9 aspect ratio. And it has 10-point capacitive touch.
Wait, 10-point touch? Like, it registers all 10 fingers at once?
Yeah, exactly. And what's fascinating here is that in a healthcare setting, optimal touch performance and high-definition clarity are just entirely non-negotiable. Like, a doctor might need to instantly pinch to zoom on a highly complex X-ray.
Or an EKG scan, right?
Right, and the hardware must translate that human intent flawlessly on the very first try. There is no time for lag or missed inputs.
So it isn't just about a pretty picture, it's really about physical reliability. Looking at the build details, this monitor uses natural air cooling.
Which is actually a huge deal for a hospital.
Yeah, because instead of standard internal fans, sucking in and blowing out dust, it's completely sealed. It makes me think of a submarine, having to remain totally closed off so it doesn't circulate airborne contaminants in a sterile room.
That is a great way to look at it.
And then you add in the 3H hard glass coating, meaning it survives heavy-handed tapping and regular scrubbing with harsh chemical wipes without scratching. Plus, it has a lifespan of over 50,000 hours. So it's essentially built like a sterile tank.
It really is. And those physical defenses tied directly into its medical-grade reality. I mean, the real barrier to entry for hospital tech is the strict IEC 6060111 and 6060112 medical certifications.
Okay, those are some dense certification numbers. What do they actually mean in practice?
So, standard consumer electronics emit invisible electromagnetic noise, right? If you put a cheap, unshielded monitor next to a sensitive, life-saving heart rate machine, that noise can literally scramble the data.
Oh, wow. I hadn't even thought of the interference factor.
Yeah, so that high price tag pays for rigorous healthcare safety standards and electronic shielding. You are buying guaranteed interference prevention, not just pixels.
So the hardware is physically locked down against contamination and electromagnetic interference.
Right.
But what about the software side? Because there is an AHA security feature regarding the user experience that really caught my attention.
The OSD menu buttons.
Yes, exactly. The on-screen display buttons are physically lockable. At first, locking brightness and contrast buttons seems, I don't know, kind of paranoid.
It does sound a bit extreme for a standard monitor.
Right, but then you think about it, and a 10% accidental drop in monitor contrast could make a subtle hairline fracture completely vanish from an X-ray.
Exactly. If we connect this to the bigger picture, a hospital is a multi-shift, high-traffic environment. Dozens of different people use the exact same workstation around the clock.
Ah, so it stops someone from tweaking the brightness because the room was dark at 3 a.m.
Spot on. By locking those buttons, IT departments prevent anyone from accidentally altering crucial display calibration. It completely removes human error from the visual equation.
Ensuring the doctor on the night shift sees the exact same image values as the nurse on the morning shift. That really reframes how everyday objects are aggressively modified for high-stakes environments.
It really does. It changes how you see the equipment.
And for hospital administrators managing budgets, $1,600 is a steep initial investment. But they're looking at it as a calculated infrastructure choice, factoring in the 3-year warranty from Hall Technologies, the free USA shipping, and, an available 15% discount code. The math really shifts.
Yeah, it shifts from a consumer splurge to a long-term enterprise solution for these clinics.
Exactly. It is a vital piece of the hidden foundation keeping modern medicine running smoothly.
Definitely. And this raises an important question. As hospital workflows become entirely digitized, replacing physical clipboards and paper charts, how much of patient safety silently relies on the invisible durability of the glass screens our healthcare workers touch every single day?
That is a fantastic point to end on and something for you to think about next time you're at the doctor's office. Thank you for joining us on this deep dive.